Good morning, Chairman Smith, Ranking Member Neal, and members of the committee. My name is Sam Adolphsen. I'm the Policy Director at the Foundation for Government Accountability. Before I joined FGA, I oversaw TANF as the Chief Operating Officer of the Maine Department of Health and Human Services. Cash welfare was once broken in this country, and so broken, it led to something pretty extraordinary: successful bipartisan reform. And when President Bill Clinton said it was time to end welfare as we knew it, this body acted and made it happen, at least in this program. And this committee knows the story of that success well: increased incomes, decreased poverty, and less spending. And it clearly understands how important it is to protect that success by acknowledging the remaining problem areas in the program. The program has drifted from the core mission of getting people back to work. And it's clear that stronger guardrails are needed to reverse this trend. Fraud and waste is a problem in the program. Issues like EBT card skimming and selling and theft of TANF funds by administrators in several states continue to plague the program. It's hard to gauge the exact scope of fraud because, as the GAO pointed out this summer, Health and Human Services doesn't measure it. And the few special OIG reports that we do have show rates of improper payments up to 46%. Misallocation is an issue too. The combination of flexibility, carryover funds, and commingling with other funding often leads to, at best, questionable spending. For example, more than 40 states spend TANF on programs with eligibility levels twice the federal poverty line. In Maine, I saw this firsthand when we ultimately reversed some TANF transactions after struggling to get clear answers from the Obama administration on how funds could be used for certain services. And there is blatant misuse as well. Some states are spending billions of TANF dollars as a slush fund to pay for college tuition programs, universal basic income projects, or tax credits in lieu of using state general funds. At least one state isn't shy about publicly calling this a fund swap. These issues need attention. But it isn't just about fraud or misspending or misallocation. It's also about missed opportunities. Missed opportunities to use TANF in the best way possible for work, to fulfill the core program objectives, to help millions more people achieve the American dream. When only 1 out of every $10 is spent on that mission today, we know there is a missed opportunity. When so many states are falling short of meeting work participation rates, we know states aren't doing their best. And when the program spends more on administration than it does on key objectives, we know we can do better. Discussions about caseload size too often center entirely around those receiving a cash benefit. But there are tens of millions of able-bodied adults in welfare programs across the country who could benefit from case management, family supports, and job training, the precise type of programs TANF is meant to fund. It makes sense then to rebalance spending back towards work with additional guardrails, like ensuring a baseline amount is spent on work activities and supports. And the program does need more oversight. A good start would be to reserve funds for those below certain income levels, measure improper payments within the program, just like other welfare programs do, and increase required state accountability for performance and spending. With some reform and a renewed focus, we can make sure that TANF is the premier welfare to work program that it was always meant to be. So it really central to the whole thing is what's central to TANF and its work. If you look at one of the leading predictors of whether someone in recovery will relapse in substance abuse, it's whether or not they have a job. If you look at rates of depression they're much, much higher among those who are unemployed. Work is really central to the well-being and ultimately the health of the individual. And TANF has recognized that since 1996. That's why a big part of why the core objectives revolve around work. And so what I would do first, particularly as it relates to TANF, is take this incredible resource, which is these available TANF funds that you have right now, that states have right now, and I would put those to work in other welfare programs.
But would you, okay, so you would, in your mind, you would use actually sort of the TANF model, which we already are having the conversation of, we have bad actors who have been sending the money in ways that are not helping the poor. And would you consider a universal rethinking and consolidation of, because there's dozens of different silos we've created over the years thinking we're being helpful?
Sure, and I think there's an even simpler answer, which is just take the two largest programs, welfare programs by participants are the SNAP program, food stamps, and Medicaid. And in Medicaid, there are nearly 40 million able-bodied adults, many with kids in the house, all under 133% of federal poverty limit. Same in the food stamp program. There's 10 million able-bodied parents on food stamps. Those folks are not on our TANF caseloads in the states. They come into the office, and if they're eligible, they walk away with a plastic card for food stamps or for Medicaid, and we say, good luck. TANF was designed to say, we're going to give you some cash, some help, but we're also going to help you. We're going to engage with you. And if we did that for those millions of folks in those other programs, even using TANF funds, I think we could close the gap.